This is an extraordinary moment. After she's gone through a remediation process, her genes are starting to go to normal.
Dr. Heyman and his constituents have developed a genetic profile where they can watch a person's react to their environments and treatments.
This is a woman whose neurologist cannot believe her Parkinson's symptoms are improving.
You're about to watch visual of what a genomics lab looks like, showing the reversal of a Parkinson's patient's symptoms.
Who otherwise had a diagnosis of early onset Parkinson's, who had failed conventional therapy. And she's getting better, which is to say we are cracking the code.
This is not supposed to be possible. This is extraordinary. It's never happened before. It all starts with the remediation of the home. None of this is possible if the client is living in a contaminated biohazard. I'm Brian Suggs. I'm the NWA mold inspector and the newly appointed regional director for NORMI, Arkansas, Oklahoma, Missouri. Take this moment to thank Michael Pinto for being my mentor and bringing me along this track. Also, President Doug Hoffman, the president of NORMI, for really, I cut my teeth with NORMI when I got into this business 15 years ago, and I owe all of that to NORMI. My career has been spectacular. And also our national director, Skip Jankowski, for really bringing the medical board team and marrying that up with NORMI's 10,000 members together. So we have, as an organization, a medical board with the top research doctor in the industry, Dr. Andrew Heyman, which everybody will know is closely associated with Dr. Schumacher. So Dr. Andrew Heyman is the chairman of our medical board. He's a fellowship director of integrative medicine at George Washington University, which we now have a George Washington University class that we can take that's going to integrate mold assessors and remediators and the medical side of it. So there is a class available coming up in August. Huge shout out to the NORMI organization. Thank you for having confidence in me. My job is going to be to bring assessors and remediators along to get in the NORMI Pro track. The NORMI Pro track is these sounds, protocols, and remediation techniques. We have to heal these houses so that our clients can heal. So the level 4 protocol that was approved by Dr. Heyman and actually collaborated the NORMI professional practices, level 4 remediation protocols for biotoxins, and that is, you will learn about that in the NCRSI class. All of this is a push to get in the NCRSI track so that when we generate these national leads and they show up on your desk, that you know what to do with them. Otherwise, we've got to find somebody else that does. It's exciting. Why I'm doing this video today. NORMI has a Tuesday night training. It's a CE hour. There's just so much good information. So the last 2 weeks, we've had Dr. Andrew Heyman explaining what they're doing, how we integrate. NORMI's membership's $20 a month. You'll have total access. You can go back and watch all of these videos and all this information. I'm telling you, it's a game changer. General public can go on NORMI, click on the general public, and you can watch for free for a couple of weeks here, or join. It's not expensive. So what you're about to watch is, an industry watershed moment. I can't stress enough what you're fixing to witness. So you're gonna see a visual of the genomics. Dr. Heyman and his constituents have developed a genetic profile, they call it genomics, where they can watch a person's react to their environments and treatments real time. You're about to watch visual of what a genomics lab looks like from the lab that does that, genomics, showing the reversal of a Parkinson's patient's symptoms, 54-year-old female. So this is not supposed to be possible. This is extraordinary. It's never happened before, the best that I know. He's going to talk about it in length. And it all starts with the remediation of the home. None of this is possible if the client is living in a contaminated biohazard. So they can tell. There are subsets of genomics that tells if they're in a contaminated environment, and they can't start therapy until those genomic labs are showing them in the normal hedging towards the normal range in that category. So they know when their client can start the VIP treatment, which is a peptide treatment that they've developed. We've got to do medically sound remediation and assessment. Then they can get on with the therapies. And after 6 to 12 months on the therapies, then they're going to see what you're going to see here, which is an extraordinary moment in this person's life where he has reversed Parkinson's symptoms. So it should be incredibly exciting for anybody that's ever had a client that has had an inflammatory disorder, that had brain fog, all the different things. I've got one with severe arthritis right now. Everybody, basically everything in this biotoxin arena, the clients have an inflammation problem. Well, that's what the genomics is about. Visual contrast testing. So they've developed the whole array of tests that can be done to help our clients get on the track back to a normal life. So without further ado, the video you're fixing to watch is cut out of an hour 15 video from Tuesday night. So geek out and enjoy it as much as I did.
Is it possible that a mold exposure can lead to Parkinson's disease, for example? So we started looking at gene sequences that had already been identified that are turned on abnormally in Parkinson's disease. And we asked the question, is that same potential true in this illness? Can we see the same set of genes turned on in a subset of our mold patients? And sure enough, we did. And we found 3 sets of genes in particular. We call this a triple positive. 3 sets of genes that if they turn on simultaneously, the risk associated with Parkinson's disease goes up. Now, is this the end of the story? No, it's just the beginning. Is this the final set of genes? No. This is genes pointing in a direction. Does it mean if these genes are turned on, you're guaranteed to get Parkinson's? No. But the pattern is there. And that's what this is about, sort of doing the deep dive to offer up this notion of pattern recognition. So what do those patterns look like? How do I measure those patterns? Well, here is a report from a Parkinson's patient of mine. And we color code these genes, these mitochondrial genes, where if they're blue, they're under functioning. If they're red, they're over functioning. And you don't need to know anything about these categories other than to say, if a clear circle is normal, I can tell you this is an individual who has a deep abnormality in her set of mitochondrial genes. Her mitochondria, her cells are in deep distress as a result of her exposure to a water-damaged building. We can see the molecular shifts that we would expect to see in that population. We can see the excessive inflammation, but we can also, for example, identify the genes that turn on to the environment. These are part of the cell stress signal pathways that correlate to the types of exposures that we now know we can test for in the environment. And certain patterns of gene sequences seem to relate to specific exposures, that there does appear to be an association between a certain pattern in mold and a different pattern in bacteria and a different pattern in endotoxins and a different pattern in beta-glucans. And the more research we do, the more we can begin to tie together known exposure, swab results in a home or air testing with symptoms, labs, brain scans, and now genomics. And we can see at the bottom, section 19 says Parkinson's, all of her genes are turned on, but she had the triple positive. Now, what does she look like 9 months later? Well, if you look from left to right, after she's gone through a remediation process, after she's gone through a series of treatments, including she's now currently on VIP, if you just glance left to right, you can see her genes are starting to go to normal. She's starting to resolve the aberrant patterns of gene expression. This is an extraordinary moment and an extraordinary finding that we have sort of molecular detail around re-regulation of gene response of the mitochondria and a restoration of energy production and cell-to-cell communication, reduction of an inflammatory drive, and improvement of cell energetics in general. Now, one of the triple positives, this is one of the 3 sections, starting to go to normal. If you look from left to right, you can see resolution. And if you look at section 9 and 10, we can see the improvement in her reaction to her living space, that the remediation techniques are working. And if we look from left to right again, you can see resolution of the disease process, including improvement of her 2 other triple positive sections. This is a woman who's beating the odds. This is a woman whose neurologist cannot believe her Parkinson's symptoms are improving. She's a 54-year-old female who otherwise had a diagnosis of early onset Parkinson's, who had failed conventional therapy. And she's getting better. This should not happen if you read the textbook. And yet, this is the sort of pinnacle, I think, of the current science today, which is to say we are cracking the code on what is a medical standard for remediation and sanitization, and what is a medical standard for assessment and treatment in these complex patients. And we had to do the deep dive. We had to take advantage of the new science to get there. No more guessing.